On October 19, 2021, Penny Kerrigan landed at Mills Memorial Hospital on an air ambulance flight from Haida, Guay, in agony.
I was in extreme pain.
She was wheeled into a hospital room, given Tylenol, and left alone. When a nurse attended, Penny said it was under an air of suspicion.
Maybe because I came from an Indigenous community, a small Indigenous community, I felt that they thought that I was drug seeking.
Penny also said nurses were unnecessarily rough with her while administering blood samples.
I was crying, it hurt so bad, she just didn't care. It was violent, it was absolutely violent. And I was like so traumatized.
Penny's experience, laid out in a BC Human Rights Tribunal case filed the day after the visit, explains how she was discharged at 11 p.m.
And I go, where am I gonna go? And what am I gonna do? And she says, well, didn't you have a plan? Don't you have a voucher? And I said, well, what am I gonna do? She said, call a cab.
Penny spent the night in a hotel in pain and alone. Come morning, Penny didn't want to go back to the Terrace Hospital. But her daughter pressed her, even called the hospital staff, pleading with them to treat her mom better.
She promised me that they'll be good, they'll take me in, and I will see the surgeon.
Because it turns out the pain was due to a widening of her appendix. She needed to see a surgeon to get it removed, or it could burst.
The doctor came, he examined me, and he told me he was sorry that, that they had missed the what was happening, and then he did surgery on me.
Penny's human rights complaint against Northern Health alleges anti-Indigenous discrimination by hospital staff. The tribunal issued a ruling in July approving Northern Health's application to add the doctor in charge of Penny's care as a defendant. Northern Health denies discrimination against Penny and claims its treatment of her was appropriate and reasonable. But the tribunal decision says that while Northern Health denies discrimination by its staff in this case, it acknowledges a long history of racism towards Indigenous people in BC, including in medical settings, something that is also acknowledged by the College of BC Nurses and Midwives.
It's so clear, the harms that have been created by a system that is intrinsically racist. And individuals acting within that system are driven to act in that way because of the fact that the system around them supports that behavior.
Johansson is the CEO of a body that sets standards for nurses. It manages the complaints process and is responsible for curriculum in educational institutions.
How come we're not hearing more about consequences or of a new modality that will lead to these behavioral changes a little bit faster so that Indigenous people aren't being so incredibly harmed to this level?
So it's a great question, right? It's how do you shift culture? So we're influencing the curriculum in nursing and midwifery programs. We are working with the health authorities in partnership and with Ministry of Health to identify educational resources that nurses and midwives should take, must take. But it's one thing for somebody to learn something. It's another thing for them to apply that learning.
That's something that's also fundamental to Penny.
Understanding what happened to our people is really important. You can't learn that in 2 hours or 4 hours. It needs to be in all the medical curriculum, including doctors, nurses, the hospital administration, hospital cleaning staff, everybody.
Johansson says promising changes are on the way when the new Health Professions and Occupations Act is implemented. It lists anti-Indigenous racism as a serious harm.
It actually requires registrants to demonstrate anti-racist behavior or to be non-discriminatory. So it gives more teeth, I think, and clearer certainty around what constitutes a serious harm.
Something the Minister of Health says has been a long time coming.
It's taken way, way too long. Why? Because of the depth and the impact of that racism over time. And so the current law, which we've been functioning over, of course, and people have been living in for a long time, and the current law is about 30 years. There was a predecessor law. There was a law before that for health professions. Didn't do that. And whatever we think of those times, that wasn't seen as a priority or a need at that time. And that's clearly wrong.
The new legislation passed its third reading this month and could come into effect early next year. Angela Sterritt, CBC News, Vancouver.